Friday, May 18th, and must be time for another legislative update from your North Carolina Medical Society. They're back, along with 15,000 of their closest teacher friends for the beginning of the short session. But before we get into that, I want to first talk to you about the news that you have surely seen this week, both reported widely in the newspaper and in our bulletin yesterday, about the North Carolina Treasurer demanding a 15% cut in provider costs to the state health plan over the next year. Time and time again, rate cuts have been shown not to actually save any money and to really only cause more problems for both patients and ultimately plans in the long run. We, as your voice for physicians and physicians' assistants, reflect what you tell us, and that is that you are committed to not only taking care of your patients and improving their health, but to saving overall cost in healthcare. But to do that, it takes cooperation, it takes teamwork, and it takes a willingness to get together and problem solve in new and fresh ways. And reverting back to the same old tired problem solving is not going to get us there. So we continue to reach out to the state health plan to try to solve this problem, to try to identify the problems that they're having internally and understand those problems in a way that we can break it down and be a part of the solution. We are working on that at every level of our organization right now, from our regulatory team all the way to our chief executive officer. And we will be including you in that problem solving over the next few weeks as we try to respond to Blue Cross as the vendor, to the state health plan as the plan, and to the treasurer as the executive who is working on this for a better outcome for state workers and their families. So look to us for further guidance on that. We will be reporting back to you regularly about this. This is a top priority for us. And while this isn't a legislative issue right now, we thought it was important that we spoke to you directly about that today. On the legislative front, first day out, we had a health meeting in the House Health. Now, we were dealing with the need for school psychologists and expediting access to licensure for those school psychologists that are looking to move here to help our students, especially in light of the school violence that has occurred across our nation. We expect that there will be a lot of new items coming out for discussion around insurance regulation, around Medicaid especially will be a high topic this year, and then around the budget. It is rumored that the budget has been worked on for a number of weeks by legislative leaders. We have been able to interact with them to some degree during that time, but a lot of that has been behind closed doors. We're not quite sure exactly what the process for the budget is going to be this year, but we'll be updating you on what we see there. We expect that there will not be any rate cuts in Medicaid, that there will not be any major plan design changes in the current Medicaid process, although there could be significant changes still under consideration for Medicaid transformation. So we'll be bringing you more information and telling you ways that you can connect with your legislators about that. Remember that we were saying that this is a short window of opportunity to connect with your legislators because we're only going to be around for 6 or 7 weeks, maybe to the beginning of July. So be ready, talking to your legislators already about what they view as their priorities so that we can understand where our priorities fit in with those. The one thing that I want to celebrate this week, we didn't have a group of 15,000 like the teachers, but we had a dozen folks here that did an incredible job for our first White Coat Wednesday. Big shout out to the UNC School of Medicine who brought over a team of first-year medical students. They took time off of their studying from their first-year exams to come over and learn a little bit about health policy and advocacy and begin that all-important relationship building that we ask you to do all the time. They went from legislator's office to legislator's office, getting to know them, understanding the lay of the land, finding out what legislators think is important, understanding how healthcare fits in as a major priority for our state, and really beginning to talk about how they care for their patients or how they will care for their patients in the future as an active citizen here in North Carolina, because most of these people we're talking about trying to stay and be just like you, be a member of the Medical Society and be a member of North Carolina, taking care of North Carolina patients in the future. So shout out to them, thank you. Some of them are already planning to come back, and I hope that you will consider to come over these next couple of weeks. We need you here. We need white coats regularly walking around on Wednesdays, talking to legislators and helping them understand our issues And if not, understanding the deep, dark complexities of what we're talking about in the issue world, just to have those relationships, just to be seen and know that you're watching what's going on, that you're interested in what they're doing, and that you are wanting to be a part of that decision-making process. So I hope you will consider taking a Wednesday morning and coming down and joining us in the next couple of weeks. And if you can't, at least keep watching these videos and sharing these with your friends so that they can be caught up on what we're doing. We'll bring you more information next week as we get deeper into legislative session and a full week of committee meetings. Until then, have a good one and look at our legislative blog for daily updates. Take care.